If you have an L4-5 disc bulge and you keep waking up with severe sciatica or leg pain every single morning, your sleeping position might be re-injuring your disc all night long. After 22 years treating lower back patients, I've seen the same mistake over and over. People follow the standard advice: sleep with a pillow between their knees or keep their legs elevated, and they still wake up feeling worse than when they went to bed. What most people never realize is that your disc absorbs fluid overnight and becomes more vulnerable in the morning, which means the wrong sleeping position can keep irritating the nerve for 6 to 8 hours straight while you sleep. In this video, I'm going to show you 7 sleep positioning changes that can help reduce severe morning sciatica. I will also show you the one movement that spikes pressure on the disc before you even stand up, and a simple gravity traction trick that helps to decompress your disc while sleeping. Now, hardly anyone talks about this, but I will give it to you in this video. If you implement these steps, you may wake up with less pain, less stiffness, and stop aggravating your L4-5 disc every single night. Be sure to watch to the end, because even missing one part of this video could be the reason your symptoms keep flaring up every morning. Hi, I'm Dr. Tam, chiropractor here in San Jose, California. I have created this channel for people dealing with back pain, disc injuries, and sciatica who are tired of quick fixes and want to finally understand what is actually causing their pain. Now, here you're going to learn safe, science-based strategies to reduce pain, move better, and get back to living without constantly worrying about your back. Subscribe if you want clear answers and real results. If you have an L4-L5 disc bulge, you've probably experienced this before. You go to bed feeling relatively okay, then wake up with severe sciatica, leg pain, stiffness, or foot tingling that feels worse than the night before. And that confuses a lot of people, because sleep is supposed to help the body recover, not leave you barely able to stand up in the morning. One of the biggest frustrations that I hear from patients is, I'm already sleeping with a pillow between my knees, so why do I still wake up in pain? The problem is most people are following generic advice without understanding the small positioning mistakes that quietly keep irritating the nerve all night long. In a moment, I'm going to walk you through 7 sleep hacks and position changes that may help reduce the stress going through your L4-5 disc overnight, reduce severe morning sciatica, and help you stop waking up in pain every single day. And the first step actually starts before you even get into bed, because you want to begin relieving some of the compression and irritation that built up in the L4-5 disc throughout the day. Before you even lie down for the night, you want to avoid going into sleep with the L4-5 disc already compressed, stiff, and irritated from the day. This is one of the biggest things most people never think about. They spend the entire day sitting, bending, guarding, and shifting away from pain, then immediately collapse into bed without ever resetting the lower back first. And many patients start noticing that the nights they go to bed already flared up are usually the nights they wake up with the worst sciatica and leg pain the next morning. That is exactly why a short decompression routine before you get into bed can make a huge difference. Start with 60 seconds of gentle standing lumbar extensions with your hands on your hips. Then I want you to move into a 90 seconds of supported child's pose using a rolled blanket or a towel under your chest or hips for added support. And then you're going to finish with 2 minutes of gentle knee to chest rocking while laying on your back to relax tension through the lower back muscles before you sleep. The goal is not aggressive stretching. The goal is reducing compression and asymmetrical stress before the disc enters its overnight rehydration phase. And once you have relieved some of the compression built up throughout the day, the next step is making sure you do not immediately collapse into that position that keeps stressing the disc all night long. Step number 2 is the pelvic tilt neutral test before getting into bed. One of the biggest mistakes people make with an L4-5 disc bulge is lying down without ever resetting their spine first. Most people simply collapse into whatever position the mattress puts them in, especially when they are exhausted at the end of the day. But if your lower back starts the night twisted, flattened, or overly arched, the disc can stay irritated for hours while you sleep. Before getting into bed, stand beside the mattress and slowly perform gentle anterior and posterior pelvic tilts. Tilt forward slightly, then backward slightly. As you do this, pay close attention to the position where your lower back and your leg symptoms feel the calmest and most neutral. A lot of patients notice that there is one position where the tension suddenly feels lower, even if only just slightly. That midpoint is usually your lumbar neutral. Once you find it, carefully lower yourself into bed while maintaining that same pelvic position instead of relaxing and collapsing immediately onto the mattress. This small adjustment can significantly reduce asymmetrical stress on the L4-5 disc overnight. And once your spine is set in a more neutral position, the next thing that determines whether side sleeping helps or hurts your L4-5 disc is, are your hips supported through the night? Step number 3 is the pillow between your knees upgrade hack. A lot of people with an L4-5 disc bulge have already been told, sleep on your side with a pillow between your knees. But one of the biggest problems I see is that nobody explains how to actually set that position correctly. Most people grab any pillow they can find, place it between their knees, and assume they are protecting their disc. But if the pillow thickness does not match your hip width, the top of the leg starts to collapse towards the mattress during the night. Now that creates rotational stress through the L4-5 disc segment for 6 to 8 hours while you sleep. And the frustrating part is that the position can still feel comfortable while the nerve stays irritated underneath. A lot of patients start realizing this after noticing they wake up feeling worse even though they thought they slept in a good position. The goal is to create enough support so the top knee and hip stay level instead of falling downwards towards the bed. When you lie on your side, your top leg should feel supported and relaxed, not like it's pulling or twisting your lower back. If your pillow is too thin, use a thicker one until your hips feel more balanced and stable. That one adjustment alone can dramatically reduce overnight stress on the L4-5 disc. And once your hips are properly supported, the next thing that matters is whether you are actually sleeping on the correct side for your specific disc bulge and nerve symptoms. Step number 4 is the side-to-side directional rule. This mistake is almost never discussed online, but it matters a lot for an L4-5 disc bulge. The side you sleep on can directly change how much space the irritated nerve has overnight. For example, if your disc bulge is compressing the nerve more on the left side, sleeping on the left side can close that space down even further, increasing sciatica, leg pain, or tingling into the foot. In many cases, sleeping on the opposite side helps open that area and reduces pressure on the nerve. And this is something many people start noticing once they actually pay attention to it. One side sleeping position often feels dramatically worse within minutes, but most patients never connect it to the direction of the disc bulge itself. So if your symptoms are worse down the left leg, try sleeping on the opposite side for several nights and monitor whether your morning sciatica or leg pain improves. The same principle applies in reverse for right-sided symptoms. I had a 51-year-old patient with a confirmed L4-5 disc bulge on MRI who had been waking up every night at 3 a.m. with shooting pains down her left leg. After identifying that she was sleeping on her left side and correcting her right side sleeping with the stacked hip lock, her overnight leg pain resolved within 5 days without any change to her treatment plan. That is why your sleeping position is not just about comfort, direction matters too. And for people who cannot tolerate side sleeping at all, back sleeping is often the next position to work on. But it has to be set up correctly or it can still keep stressing that L4-5 disc overnight. Step number 5 is lumbar towel roll hack for back sleepers. A lot of people with an L4-5 disc bulge feel better sleeping on their back, especially if side sleeping keeps triggering sciatica or leg pain during the night. And one of the most common recommendations online is placing a pillow under your knees. Now that can absolutely help, but for many people, it is still missing one important piece. When you lie flat on your back, the lower spine often sinks into the mattress and loses its natural curve. That flattening can increase stress throughout the L4-5 disc for hours while you sleep. Many patients start noticing this when they wake up feeling stiff, locked up, or compressed through the lower back after sleeping flat on their back all night. A simple fix is placing a rolled bath towel directly under the lower back at the belt line, not the mid-back. The towel should be about 3 to 4 inches thick. The goal is not to force a big arch. It is simply to support the natural lumbar curve so the disc is not sitting compressed against the mattress all night long. For many patients, this feels noticeably different within the first few nights. And once your sleeping position is corrected, the next major mistake happens during the actual process of getting in and out of bed. Step number 6 is the 3-point bed entry and exit protocol. One of the most underestimated moments of an L4-5 disc bulge is getting into and out of bed. Now, most people do it automatically. They twist, bend forward, swing one leg off the mattress, and use momentum to sit up. But that twisting and flexion combination can sharply increase stress through the disc, especially first thing in the morning, and the disc is already swollen and sensitive. And this is something I see constantly in practice. When I ask my patients with disc bulges to show me how they get out of bed, almost every single person demonstrates the exact twisting movement that keeps aggravating that L4-5 segment. Instead, use a 3-point sequence. First, sit on the edge of the bed before lying down. Second, lower yourself sideways using your arms to control the movement while keeping the spine neutral. And third, bring both your legs up together as one unit instead of lifting one leg at a time. To get out of bed, reverse the process. Roll onto your side first, then drop both of your feet off the edge, then push yourself upright using your arms and elbows instead of twisting through the lower back. For many people, correcting this one habit alone significantly reduces morning flare-ups and muscle spasms. Step number 7 is the disc pressure clock. Even if your sleeping position is perfect, the L4-5 disc is still at its most vulnerable during the first 30 to 60 minutes after waking. While you sleep, the discs absorb fluid and rehydrate overnight. Now that extra fluid increases the internal pressure inside the disc by morning, which means the disc is often more swollen and more sensitive when you first wake up. This is why so many people experience severe sciatica and sharp leg pain or stiffness during their first few steps in the morning. And many patients start noticing their symptoms are not necessarily worse at the end of the day, they are worse during those first few minutes after getting out of bed. One of the worst things you can do is bend forward immediately after getting out of bed while the disc is still under a high amount of pressure. Instead, when you wake up, sit at the edge of the mattress for a few minutes before standing and slowly perform 10 to 20 seated pelvic tilts to help to reduce the disc pressure gradually before loading your spine with your full body weight. And if severe morning sciatica or leg pain is still waking you up even after correcting all your sleeping positions, there is one final bonus strategy that can sometimes reduce overnight compression even further. Bonus tip, the gravity-based traction hack. This is one of the most overlooked strategies for people with an L4-5 disc bulge who wake up with severe morning pain. Instead of sleeping completely flat, try sleeping elevating the head of the bed by about 10 to 15 degrees using an adjustable bed base. Or you can just simply sleep on a wedged pillow. Now, for some back sleepers, this creates a gentle gravity-based traction effect through the lumbar spine overnight. The goal is not to forcefully stretch the lower back. It is simply to create a mild separation through the L4-5 disc segment while you sleep, so the disc and the nerve are not sitting under that much compression for hours at a time. Many patients notice that when they wake up slightly more decompressed, those first few steps in the morning feel less aggressive on the nerve. This works best for back sleepers, not side sleepers. The most important thing to understand is that most people with an L4-5 disc bulge are not necessarily re-injuring their back because they are doing one massive thing the wrong way. In many cases, it's just these small mechanical changes and stresses that repeated over and over every single night that keeps the disc irritated and the nerve inflamed. Once you start reducing those stresses consistently, mornings become usually much more predictable. Movements feel safer again, and the cycle of waking up in pain every single day finally starts calming down. You now have a complete step-by-step guide for how to reduce stress on your L4-5 disc before bed, during sleep, and the first thing in the morning, so you can stop waking up with severe sciatica, leg pain, and stiffness every day. Give each one of these 7 steps and the bonus gravity traction tip a try. Then come back and let me know in the comments which one gave you the most relief, or if it was the combination of several different things that could help. If you got value from this video, make sure to like and share it so more people struggling with severe morning sciatica and disc bulge pain can finally understand what may be actually aggravating their symptoms overnight. And remember, subscribe to this channel if you want to discover more tips on how to protect your spine, better understand your condition, and learn treatments that help people achieve long-term relief. And the next video that you should watch is this one, where I break down the 10 best exercises for an L4-5, L5-S1 disc bulge, and how to reduce pain, improve movement, and support long-term recovery. Go watch that video next.